Welcome back to Western New York Living. We're happy to be taking some extra time this morning to touch on a subject that affects 1 in 8 women in our country, breast cancer. Windsong Radiology opened its doors back in 1987 with a mission oriented towards providing world-class women's imaging. A lot has changed over 30 years, but the mission is still the same. They also understand that providing a continuum of care for their patients is equally important. Their specialized care is what sets Windsong apart from other imaging facilities. I'm sure you've all heard the saying that there is strength in numbers. That is exactly the approach they are taking at Windsong Radiology. From the doctors to the radiologists to the breast sonographers and breast navigators, it's a team of specialists focused on the patient's breast care needs.
Windsong has been recognized nationally and is very well known locally to be a leader in breast imaging. So I'm not surprised that many women choose Windsong for their breast imaging needs. And we at Windsong pride ourselves in actually taking on accreditation in all imaging modalities, not breast imaging. But with breast imaging, there are certain criteria you have to meet and show them that you excel in every aspect. So not only do we have that for mammography, we have that for breast ultrasound, we have that for breast MRI, and we have that for all image-guided procedures and interventions that we need to do.
Providing their patients with world-class breast imaging will always be at the core of what Windsong Radiology does. But a key component of what sets their breast care program apart from others and makes it unique is their multidisciplinary approach.
It really is personalized care, and it's comprehensive care. It starts with our radiologists. It's not uncommon for a woman to have her screening mammogram, and if something is found, the diagnostic biopsy all within the same day. So the workup is thorough and it's quick. And then she is part of a multidisciplinary team. So once the diagnosis is made, it truly is a group that is her care team, and they all work together very closely, from the breast surgeon to the medical oncologist to the radiation oncologist. But what I would also like to say is what's unique about our practice is we're an independent practice, and we do work with almost every physician within the community. So if a patient is from the deep southern tier, for instance, we work together with those medical oncologists and radiation oncologists there to keep the patient closer to home. So it's a unique practice. When a patient gets a breast cancer diagnosis, they really do have to understand their diagnosis, and it is a lot of information, and sometimes it can be complex information. So what we designed was an educational class, and as you said, we meet every other Monday evening, and everyone is welcome to come to that meeting, even if they don't stay at Windsong for their care. And you can bring family members or friends. But what is unique about our practice is that we are a group of physicians who work very closely together, and despite following national guidelines, everybody's treatment path is individualized. It is unique for that patient. So you may, 1 in 8 women are going to get breast cancer. So it is an individualized treatment path, and we're very conscious about that, and I think we work very well together to optimize the patient's care.
To learn more about Windsong's breast care program and to gain more information on the topics we just touched upon, you can head to their website, which is windsongbreastcare.com. Their team is committed to providing a compassionate, caring approach to all the patients they serve. You can also give them a call at 626-6300 to speak to their helpful staff.